Triage Call Logging Database by Roger Holmes, Gary Meir, David Lozier, Lena Smith, and Andrew Dean. This is our final project for ISC 455 at the University of South Alabama Health Informatics Program. Summary: the Triage Call Logging Database will allow healthcare providers to allocate all calls into a database so that patient calls can be returned. Make it easier for nurses to identify calls that have been returned or not been returned. Allow the triage nurse to record and document calls with patient information. The database will allow the nurse to see what patients have called, if their call was an emergency, the time the patient called, and categories for returned or not returned phone calls. The database will eliminate the nonsense of recorded voicemails, paper notices, forgetfulness, and the amount of time needed and taken to document a phone call. Patient and doctor advantage. Doctors and nurses will see recent visits and medical records by having the patient ID available. In the future, the database will provide optional add-ons such as voicemail, voice dictation, automatic CPOE on messages left. Improve customer satisfaction and patient care, reduce missed calls, eliminate handwritten messages, allow for quicker response time, provide immediate assessment, and 100% adoption by all healthcare staff. The risks associated are the functioning of system throughout the hospital, time needed to check system, and buy-in from staff, and of course cost.
All right. This is Gary, and This is Gary Meir, and I'll be giving you the peek at our database, running through some of the functions and what it's capable of doing. As you can see here, I've got the patient screen up. The next screen over is our call log, the actual log of the calls that are coming in. These are the two nurses we have that will be answering calls, and we have two queries out: calls that have not been returned and calls that have been returned. Right now we have two calls that have not been returned, so you can see they don't have a nurse ID because no nurse has returned those yet. So the first thing I want to do is check our call log, and we'll have a nurse take a look at this patient here, and the patient ID number is already in, so we know which patient that they're going to call back. In this particular case, that's going to be our 987, so they're going to call Joe Jones back. Once they've done that, they will give the call return, and depending on which nurse it is, we'll have it to be Andrew. They'll put in their number for the nurse ID, and we'll enter through that, and that will get this out of there. Once we run our query again, we run our query, and that call has now been returned. So when we run our query on the calls returned, you'll see the second call that will come up as a returned call. So we've run that query, and now all the first five calls have been returned. And again, we can do the same thing when another nurse answers call 6. We can have that nurse put the information in that they've returned the call and their ID, and when we run our query, it will remove it from calls not returned. Oops. After we enter the data, we rerun our query, and now our calls not returned database is empty, and we rerun our query on calls returned, and there we have all 6 calls have been returned, which nurse made that return call, and which patient it was. So then we can go back to our patient database, and a new patient may come in or may call in, and we'll just give them a ID number here. Use a fake social security number. And give them a fake name here. And a birth date. And the phone number that they can be reached back at. And we return that so the data is entered in. We won't be adding a nurse. We already have 2 nurses, so we don't need another one. But we will have a new time of call. So on 12/5/2012, and we'll make this at about 16:30. And that call has not been returned yet. It just came in, and it came in from our new patient with our new social security number. And then that call would be passed on to the nurse. The nurse can look up and see that that call has not been returned yet by going into the call return log, and we run our database. The nurse knows that this patient has called in. They were the 7th call for the day, and they've called in, so they can go back to the patient log, find that patient, get the phone number, call the patient, and once they've called and talked to the patient, they can check the box for call returned. I'm just going to go and show that the 7th call does not show up in the calls return log, and it is in the calls not returned. But once the nurses called them back, that nurse would come in and say that they've returned the call, and we'll have Andrew take care of that call there, and make sure we enter through so the data is entered properly. Go back to calls not returned, and you see it put the checkbox there, but when we run the actual query, there are no more calls that have not been returned. And when we run our query on calls returned, it now is a returned call. So you can see that our database works well for making sure that all calls that come in for the day have been returned to the patients, and any calls that the nurse needs to take care of will be in the calls not returned log, and they can address those throughout the day. Thank you very much. That's our database. Have a wonderful Christmas.
To conclude, you can see that this database will improve customer satisfaction and patient care, reduce missed calls, eliminate handwritten messages, and allow for quicker response time, provide immediate assessment at 100% adoption by all healthcare staff. The function of the system throughout the entire hospital, the time needed to check the system, the buy-in from staff, and cost would be the only risks associated with this. But it's obvious to see that a system like this would be a huge advantage for any physician's office. It should make for much better communication, effective communication, and overall, it should be a very cost-effective product. Thank you very much for taking the time to watch this demonstration. Have a Merry Christmas.